I told Good evening, everyone. We're a little bit early, but while we're waiting, will you please, if you're online, go ahead and write your name and your organization if you have one. Anything you want to say about yourself in chat, we can have a record. Thank you. So good afternoon. My name is Kathleen Beckman. I'm chair of the board of directors of the Continuum of Care. So I want to welcome you to our general membership meeting. Thank you all for being here in person at the Boley Center, which has graciously hosted this meeting in person. And welcome to all of those who are online. We appreciate your attendance. As we start every meeting, I just want to articulate what our CoC, our Continuum of Care mission and vision is, why we are here, the importance of this work. So our mission is to coordinate all community partners, systems, and resources available with a goal of helping individuals and families to prevent, divert, and end homelessness in Pinellas County. And our vision, our ultimate goal, is to make homelessness rare, brief, and a one-time experience. Our CoC is a HUD-mandated organization, entity that oversees funding decisions in our county with the goal of preventing and reducing homelessness, as well as setting priority populations and interventions, and working to coordinate all those partners within our community who touch or impact or intervene with the lives of those who are on the verge of homelessness or experiencing homelessness or coming out of homelessness with wraparound services and things like that. So with that, you have the agenda in front of you, and I'm sure the agenda was made available online. We are here at the Boley Centers in St. Pete, and I want to thank, first of all, Boley Centers for hosting our meeting tonight, as well as Sherry Holzbacher, the CEO of HLA, our lead agency, for coordinating this meeting and putting things together. And I'm going to turn it over to my friend and fellow board member, also a member of our executive committee, Kevin Marone, who is CEO and president of the Boley Centers, as well as chair of our providers council.
Right. Good evening, everyone. As Kathleen said, I'm Kevin Marone. I'm the CEO of the Boley Centers and the host of this site here. Welcome here to Boley Centers. I also have with me a couple of my team members in the room. I have Damon Kelly, who's our Vice President of Homeless Services. And on Zoom, I have our CFO, Michelle Joseph, and there's another person, Abby Collins. She's VP of our residential and clinical services. I've been tasked with giving you a little bit of an overview of the organization and model and how we deliver housing services. So I have a presentation here prepared for you all to kind of walk you through a little bit of our organization and history. And I'll be happy to answer any questions that you have at the end of the presentation. So I'll first start off with just a little bit of history on the organization. Boley Centers began in 1970 as a single home known then as Boley Manor. It was spearheaded by really four women that had children with mental health disabilities and believed that with the right housing and mental health supports, people could be successful and live independently in the community. And Mrs. Bessie Boley, who the organization is named after, donated $50,000 for this building you see here in the picture, which is Martin Luther King and 12th Avenue North. And that was the original Boley Manor. We no longer own that building, but it did serve as the very first home for Boley, and it served men and women that were coming out of state hospitals during deinstitutionalization era. From that time on, a lot of grassroots efforts were made to kind of expand it from that one home into about 12 different residential programs throughout Pinellas County, growing it from the original 40 beds to over 250 residential beds. As time moved on, what we learned through our model of psychosocial rehab is people with the right medications, the right supports, get better and actually achieve higher levels of independence. So from that point, Boley's mission of moving into more independence and housing and apartments and permanent supportive housing models kind of began. I'm going to dive a little bit into our mission, our accreditation, and some of our different programs. So our mission at Boley Centers is to provide at-risk populations with access to safe, affordable housing, along with the behavioral health and employment services that support their personal growth. We are accredited through CARF, which is the Commission on Accreditation for Rehabilitation Facilities, which is an international organization looking at standards of how to, provide quality services. Who we are has evolved over time. We started out really as a behavioral health service provider through mental health state dollars, but we've evolved into obviously a very large homeless service provider because it's a big part of the mission of housing. But we also do employment and youth services. We are an affordable housing developer, so we develop the housing that we own and operate. We are the landlord and do all the housing management, property management for our facilities. We are also a small housing authority and administer housing vouchers from 4 different programs. Through our Chief Operating Officer, Jack Humber, we are also the Florida affiliate for the Southeast ADA Center. So we actually consult on ADA services and provide technical assistance around the state on how to ensure facilities, areas are set up according to ADA standards. We do this through a variety of different measures, residential treatment programs, psychosocial rehab, and supported housing. We're scattered throughout Pinellas County. Here's sort of a geographical map of our locations. Large portion of this is in the St. Petersburg area, but we have distribution in Mid-County and a few properties in North County and the Clearwater area as well. Pinellas Affordable Living, Inc., also known as PAL, is an affiliate organization. This is a community housing development organization, so it's an affiliate of Boley Centers, and this organization was set up with its primary mission for the development of affordable housing. So when we're developing housing, it is developed under this entity, and then in collaboration and partnership with Boley Centers to provide all of these services for the people living in housing. One of our most recent developments was Founders Point in St. Petersburg off of 31st Street South. We opened this on August 29th, 2025. This is 15 one-bedroom units for individuals with special needs. There are also project-based vouchers in partnership with the St. Petersburg Housing Authority that ensures the affordability of these units. Our next development is called Lealman Landing in Lealman. And it is we're getting ready to break ground on this project. Hopefully construction will start in May. We have project-based vouchers here through the Pinellas County Housing Authority to ensure the affordability. And we hope to open this at either the end of 2026 or early 2027. So it'll be 17 units of affordable housing for a disabled population. Housing management, property management is a big part of what we do. In addition to the services we provide, we manage all the leasing and rental expectations, rent collection, and ensuring people are following the terms and standards of their lease. And then we also work with a variety of different voucher programs, including Shelter Plus Care, City Home vouchers, Hopwood vouchers, and mainstream housing vouchers. On the program side, we operate residential and clinical services. This is 4 residential treatment facilities focused on those individuals either exiting from mental health institutions, state hospitals, or revolving around crisis units and needing stabilization. People will reside in these facilities anywhere from 6 months to 12 months until stabilization has occurred and housing alternatives and arrangements have been secured and located. In conjunction with our residential treatment programs, we operate a psychosocial rehabilitation program in St. Pete. It's on a 5-acre campus that provides all kinds of education on their mental health condition, how to manage their illness, as well as social programming, arts programming. We have a theater program that runs out of this campus as well, known as Boley Centers on Broadway. And we have a partnership with Evra Health, who is on the campus 5 days a week and provides comprehensive medical, behavioral health, and specialty care. We also do care coordination services, so ensuring how people get access to all of the necessary benefits, Medicaid process, and we provide counseling on this campus as well. We also operate a supported housing program funded under what was called the HUD 811 program. This was specialized housing that during the 80s and 90s and early 2000s that provided affordable housing for individuals with disabilities. This is a traditionally like weight-based program, so we open up a wait list and people can apply. But what I can tell you about the last time we opened up the wait list, which was in the middle of 2025, is we took over 1,200 applications during that time period. So it is typical that one might wait 2 to 3 years before one of these units would be available for them. In addition to some of our brick and mortar housing that Boley operates, we have a variety of community-based programs. So these are also housing focused, mental health focused, stabilization focused, but focused on community placements. So these individuals might live in assisted living facilities. They might live in their own apartment with private landlords, but they need supports to help them live and maintain those types of settings. So we have an assertive community treatment team, which is an evidence-based practice. There are 31 ACT teams in the state of Florida, and Boley operates one of those. We also have a less intensive program called supportive living. So this is more of a scattered, think of this as like a scattered site supported housing program. And then we have a program called LINK, Living Independently Connecting Communities. This is a state-funded DCF program that is focused on behavioral health and supported housing services and filling some of the gaps that exist in the mental health sector as it relates to housing access and supports. We have a partnership with Pinellas County Health and Human Services through SAMHSA and DCF grants with a program called Treatment for Individuals Experiencing Homelessness. This is based at Pinellas Safe Harbor and is also in partnership with Elios Wellness to provide case management and engagement with individuals coming in and out of Safe Harbor to try to reconnect them to services and get them into housing. This is a relatively new program. We're in our first year of operation of this program and seeing some great success. Under our homeless program, so Dama's here in the room, and feel free, Dama, to jump in and intersect here. I'll start with our street outreach. So we do homeless street outreach to engage those without housing, whether that be through connecting with shelters or people that are on the streets. And the goal is to do assessments and identify those with the highest needs, because Boley is serving high intense, high touch population, people that require a lot of support, and you typically have high mental illness, high trauma, or substance use. Anything else you want to add to that, Damon?
I would just say that homeless street outreach is countywide.
Hmm.
And I don't know if you've got something separate in there about St. Pete. Oh, you
I do. We started a new program. Feel free to chime in on this one, Damon.
Okay, great. So yeah, this is the Firefly Project. This is funded by the city of St. Pete, and it's a very dedicated program to individuals that are currently homeless, who have severe and persistent mental illness and appear to be in need of mental health services. So these are the individuals, most of which have psychosis. They are, in some situations, I'll just give you some recent examples, walking into traffic, maybe don't have all their clothes on, reporting that there's bugs in their ears. Let's see, maybe walking up and approaching other individuals, referring to them as lizards. I mean, I could just give you all sorts of examples of situations that we're seeing where it truly is individuals that are homeless and they do have severe and persistent mental illness, and they're most likely in need of psychiatric treatment. So this program is geared a lot toward assessing individuals that lack the ability to determine whether or not they need care, which results in a Baker Act for inability to care for self. This program is also doing a very, very deep dive into these individuals and cross-referencing HMIS database, Pinellas County Clerk of Court database, our clinical avatar system, and then also being able to see which systems that they're touching and having conversations like with Daystar or with St. Vincent de Paul, wherever this individual keeps showing up, where we're trying to develop profiles and also identify family members that can become medical proxy to assist with the psychiatric intervention without court order. Really exciting. And the bus, yes, that's right in front of us. We did take one of our buses and we've turned it into an RV that does have a shower and a restroom, and the entire thing down to the color, the temperature, the textures, the smell, it's all trauma-informed care. If you notice those two wooden chairs, obviously those are going to have they're designed to be like two living room chairs, right? That you would walk in and kind of be able to sit down in if you've had like a really rough day. And we're super excited about having that. That is also going to come with all new clothes, shoes. There's food. We are going to have an awning that extends and a net and a swamp cooler for summertime. We have dog cages to put animals in. We have an outdoor shower that they could potentially wash their animals with if they won't take a shower themselves. Maybe that will be a way to get them, to it. We've tried to think of everything. And the whole goal there, right, is really engaging them, establishing that relationship while we're building that profile to figure out what's the best avenue to get them to treatment.
And I guess moving on into the treatment piece, we have 2 additional residential treatment facilities. These are level 2 licensed by ACA, along with just like the other 4, but these are safe havens. So these are funded through HUD, and then one of them is also funded through the VA to serve veterans. And these are 20-bed, 25-bed facilities to bring people from a street situation, long-term homelessness, into stabilization, and then ultimately into permanent housing. And then permanent supportive housing is our next level of model. We have over 400 now dedicated permanent supportive housing units for individuals and families that have experienced chronic homelessness and have mental health disabilities. So these are both for individuals and families. Here's a few pictures of some of our properties. We tend to build facilities that are, not large in size, integrate into neighborhoods and communities. We try to even design our buildings in conjunction with what neighborhoods buildings look like. because we believe in just sort of the normalization and of our residents and helping them feel a part of their and connected to their greater community. And the last piece that I'll talk about is supported employment. So in conjunction with all of this, some of the people that we serve are permanently disabled and may not be able to go back into the workforce, but there are many that do want to get back into work or go to school or gain new skills. And so we have supported employment services where we work with those individuals and help them get access to jobs through our various partnerships with local businesses and in the community. Our general impact to the community, this past year, we served, 2,307 people. But the more piece that tells more the story of Boley is just the intensity of services that we provide. So the 2,300 isn't a lot of people. If you look at the bottom, we provided over 171,000 services. So we are providing an intensive amount of services to the individuals that we serve. So there's a lot of touches because that's what's necessary to sustain them in housing. In the graphical there, you'll see a little bit of a breakout of this is our 2025 impact. We had provided 1,165 affordable housing opportunities. That includes all of the different pieces that we have through our new partnership with Evera Health. We were able to have over 3,130 healthcare visits to the people that we serve, getting them quicker, better quality access to healthcare. Over 250 individuals engaged through street outreach, but 124 of those were placed into housing. We had 75 families that we stabilized, which included 118 children, and something that that I think is important to recognize and that we track is that of those families, we had 0 child removals. Because a lot of times when you're managing these families, managing those children being removed from the homes, the goal is to create a stabilization system where that doesn't happen anymore. And this is evidence that when given the proper housing and supports, you can make some impacts. And then of those people that are not in our Boley housing, that are just out there in the community living in private housing situations, we served an additional 469 outside of Boley and community-based scattered site supports. 71% of our disabled households were able to get connected with employment, and 61%, we have a homeless veteran employment program as well, and 61% of those veterans were connected with housing or employment placements. Didn't talk much about our youth program, but we did serve. We have a summer youth and internship program, and we served 350 disadvantaged youth through funding through the city of St. Petersburg, as well as the Juvenile Welfare Board, and placed nearly 200 kids into employment and jobs this past year. On the fundraising side, Boley Centers does operate a thrift store. It's known as Your Neighborhood Store at Oak Tree Plaza on 9th Avenue North. It's a big philanthropic part of our mission as well, because we have people that we serve that also get hired and work in the thrift store, volunteer at the thrift store, and then we also can use the thrift store to give vouchers to our residents that don't have income or have low income to be able to go and get the essential clothes that they need. So the store serves a lot of different purposes in supporting our mission. And finally, I'll close with our 44th annual Jingle Bell Run, which is December 11th. So this is our big fundraiser, which is just a fun way to bring people together during the holidays in downtown St. Pete along the waterfront. And it's really a fun family event. It's not a competitive run. You don't have to be a runner to come. In fact, 80% of the people walk it. And that's okay. Sometimes they bring strollers and their dogs and all kinds of things. But it's just another way for us to get the importance of our mission out there to the greater community, and supporting what we do. And then that's the end of my presentation. I'm happy to answer any questions that you may have.
Any questions here in the room? Comments? Sure, Mary?
To get into a Boley program, do you initially need to be Baker acted to be evaluated?
No, I mean, there's a lot of different ways to get into Boley. You know, we're a little complex, you know, obviously in our homeless programs, you come in through coordinated entry, and that whole process. On the mental health side, our referrals are, it's a priority based. So those being discharged from state hospitals that are already institutionalized, they have the top priority for those residential beds. Those dollars are funded through our managing entity, Central Florida Behavioral Health Network, through DCF dollars. And so those beds are prioritized. If there's no state hospital referrals, then we usually go to all the different crisis units. So these are people that have already been Baker acted, and now are on stabilization unit and looking to be discharged. And so our facilities then are our discharge point for that. So the point of referral would typically come from the social worker on the crisis unit, state hospital, or there's a case manager. They can certainly advocate and work with the crisis unit to get a referral to Boley so that we can go out, screen, assess, and make those placements.
Yeah, I know a 44-year-old that was at Chattahoochee for 2 years, came to 49th Street, 3-court hearings. They released him. He walks over to Safe Harbor, then PIMS for 2 weeks, then back to Safe Harbor. Now he's at St. Joseph's in Tampa.
Okay.
And he's only 44 years old.
Yeah, so that would probably be a really appropriate referral to try and get that person screened and assessed, given that.
Yeah, how do I get him back in Pinellas County? His family won't have anything to do with him, won't tell him what their address is because they don't want him coming on their property. It's only 44. I just, the 20 people across the street from me just got kicked out. We tearing down the house.
Yeah, I'm happy to talk with you after the meeting too. That helps to, help me navigate you in their direction.
It's people 24/7 every day, and there's a lot out there.
Yes, there is.
So we need to know what the main process is. Thank you.
You're welcome. All right, well, I appreciate everyone's ear and time, and hopefully that was helpful. Sorry, there's a question.
There's one question just came out in the chat. So can you go into the numbers a little for families? Is housing set aside for families? How many? Are you at capacity now and referrals process? So a lot of questions in one.
You want to take that one, Dana?
Yeah, no, there's definitely not enough family housing. It depends on which definition of homelessness that you want to refer to, but, children that are living still in motels or, 5 or 6 children and a parent living in a 1-bedroom or a 2-bedroom. Those just are not environments that are conducive to children thriving. And the need for, if you look at, families that are actually going through rapid rehousing multiple times, and probably need a permanent supportive housing intervention, I'm sure that there's many of those that HLA could say that we would need more for. And also just with the affordability as it is, the potential cuts and benefits that we're facing, the answer is yes, there is a need.
What I can say from the Boley side is, probably if you go back 8 years ago, I don't think Boley operated any permanent supportive housing for families. We had traditionally focused on chronic adults, but there was a lot, the concerns in that area were great. We heard it at the county level, at the city's levels. And so Boley committed over the last 8 years, we've committed to developing permanent supportive housing for families. And that's where you were at the 75 unit number. So 8 years ago, that was pretty much 0. And today it's 75 units of permanent supportive housing for multifamily. And so it has been, it was added to part of our strategic plan to add that because we knew the need was great. But what I can say is that when one of those units vacates, it's the time that it takes to empty it out, repaint it, fix it up, and get it leased again. It's filled. So it doesn't take long.
And I would probably just add that the Foundation for Healthy St. Pete did a study. You could go to their website and check it out, where children that live on Snell Island are expected to live 7 years longer than the children that live in Childs Park. That in itself, I mean, it's like Childs Park is a third world country, and you know they're less than 10 miles apart. But that speaks volumes to the amount of housing that I believe that the need is there.
Another question on the chat. Are there any programs for the senior homeless population?
All of our programs are for the senior, as it relates to homeless services, the VI SPDAT recognizes age and as additional level of scoring and priority. But if the question is, do we have dedicated designated housing solely for the senior population? We do not, but it is a part of our prioritization process, and as far as vulnerability and ensuring that our units go to those with that are at the most risk in the community.
When the individual for PSH right now, the majority are 55 plus for the individuals.
I would say if you just naturally look at our demographics, it is a much older demographic, particularly in our homeless programs. Great. Well, thank you, everyone. Appreciate your time and ear.
Ready, Sherry? Sure. Okay. Okay. Well, thank you, Kevin and Dana and everyone at Boley, and thank you for hosting us here too. And answering questions around permanent supported housing and all of the other work that you all do. I want to move on to our last general membership meeting was right before the board of directors meeting in January. And prior to that, November, was it that? Yeah, November, when we got together and we went through election procedures. There was a call for nominations. Following meeting in January, we had the election. And I just want to go over some of the, basically the outcomes of that, and also some of the roles and responsibilities of our CoC board as a piece of education for all of our CoC members. So roles and responsibilities, this is the leadership team that comprises elected, appointed members, and guides the CoC in making policy decisions, evaluating community needs, implementing strategic responses, and measuring outcomes, all with the mission of ending homelessness or reducing homelessness in Pinellas County. That is the number one goal. It's what we start out with before every meeting, talking about what our mission is, that we can all be on the same page, and that's our starting point and our end point. They approve recommendations for federal HUD CoC program and DCF Unified Homelessness Grant Funds. Those recommendations come from other committees and from input across the CoC membership. They approve policies, reports, and priorities. Again, those funnel up from committees and membership. They approve the annual application for the HUD CoC program, NOFO. HLA is the lead agency designated by the CoC. We, of course, we coordinate that process. We put out the local competition and we write the final NOFO application and submit, make sure everything's submitted. But it is all approved by the CoC board before it goes forward. They also take action when needed against any poor performers of anyone who is a recipient of the CoC HUD NOFO or the state Unified Homelessness Grant Funds as well. And HLA, we conduct the monitoring and we just report back to the board any findings we have. Which right now, it just so happens it is monitoring season and it's going very well. And we don't take a punitive approach to begin with. I just want to make sure whenever you hear monitoring or audits, it sounds bad. HUD has it set up where it's supposed to be around technical assistance. It's a continuous improvement. We're learning, we're teaching, and it's cyclical. It's reciprocal. So we learn, you learn. You teach, we teach. So those are the overall responsibilities of the board. And we had some new people come on, new members, which is really exciting. Katie Blacksburg with the Pinellas County School Board was appointed in January. Dr. Monica Descolo with New Season Treatment Center. She is one of the business seats. We actually filled both business seats this year. Second one being Jason Mathis. And also we have Sandra Newson. She was an existing at-large member, but now she is the newly appointed Funders Council Chair. So she'll be joining the executive committee. And we had Dr. Joseph Smiley, who and many of you may be on screen right now, and I don't see you, but I've seen Dr. Joseph Smiley. He represents the faith-based organization seat that Sam Picard was in prior to that. And of course, he filled all of his terms, and we tried to find ways to keep him. And yeah, the charter doesn't allow for it. He has to take a year off. And then Judith Warren also is our newer member of the board. She sits on the veteran organization seat. As far as re-elected members, we had Kathleen Beckman was re-elected chair of the CoC board. Michael Cretion and Gary Small were both re-elected for lived experience seats. Deborah Fink Sanders was re-elected the vice chair. Teresa Jones was re-elected as one of the 3 at-large members. And Ross Silvers was re-elected for the Workforce and Development and Transportation seat. All of these roles, except for the officers, all of them and appointed roles. Appointed roles, there are no term limits. Those are appointed, and then there's a vote of confidence. For all other roles that are not officers, they serve 2-year terms, up to 3 terms available. For officers, it's a 3-year term, up to 2 terms. And for, like I said, the appointments, there are various entities that can appoint, and there are certain government officials that can be appointed, Providers Council, Funders Council, they make appointments, and there's service experts and other groups as well. So that is an overview of where our current membership sits with our board of directors. Anything else around some open seats, like the vacancies that you want to talk about? When there are vacancies, we do have the annual election, of course, but there are opportunities when there are vacant seats to go ahead and apply. And so you would just reach out, and we have an application for that as well.
HUD no phone?
HUD no foe. Oh, you're like next. Okay, so no pressure on that. We're going to go to the next one. Well, first off, committees that need your voice. Let's talk about committees. Would you like to start on the nominating?
Well, so we have a number of committees as part of the CoC. Funders, providers, lived experience advisory committee, advocacy committee, PIT planning committee. And any one of those, we invite general membership to join the committees and do that work. That's where you really get to see what's going on at the grassroots level. You get to lend your voice, why you care, what you're involved with your organization. That's where we need you. Many, if not most of the committees meet virtually now. It's just easier when the CoC covers the entire county, and I think it's like 67 miles from Tarpon all the way down to St. Pete Beach. Virtual has been easier for people to attend meetings and really engage. So I would encourage you to join those committees. We are right now really going through the charter with a fine-tooth comb, and we're looking at getting our charters aligned with our CoC charter with the different committee charters or council providers or funders council charters. Part of that work is looking at what our charter says about a nominating committee. So we do have some open positions, and so we want to make sure that we flesh out what the nominating committee does and their expectations. And so the executive committee we're working with legal representation, and we work in conjunction with them to really look closely at all those charters. We'll make suggestions to the different committees and the board as a whole, but, and we're in the process of doing that. What we're starting to shape and present for the nominating committee, which is not articulated in the charter, is that the nominating committee will identify, vet, and recommend qualified candidates for the service on the Continuum of Care Board of Directors. And so they would gain their authority under the authority of the CoC Executive Committee in alignment with the governance charter. And if you're interested, people online as well, in being part of the nominating committee, you know, what their goals and their scope of work would be, they're responsible for board recruitment and nominations only. It does not engage in board governance or policy development or board management. It's just about going out into the community and approaching people that you think might be a good fit for any of our vacant positions. You talk to them about the work of the CoC. That's not your sole responsibility or only your responsibility. I would say it's entire general membership, as well as, more importantly, the current board of directors, to look out and try to bring forward and encourage other people to fill those positions. But you would work in conjunction with our lead agency, the HLA, to understand what seats are available, what would be a good candidate, qualifications for that seat. You would source and recruit candidates. You'd conduct an initial screening, kind of the eligibility, the fit, conflicts of interest, all that. You'd help coordinate some vetting with the executive committee and then be part of, you know, the screening process. And we're asking for a commitment to 2 years, so that this committee would be seated for 2 years, so that we don't have to ask for members of a nominating committee again and again. And we'd like you to be, your qualifications, if you'd like to serve on the nominating committee, would be that you are a member of the CoC general membership for 2 years. It would be ideal if you have participation in at least one committee, so that you know about the work of the CoC and where that work really gets done in the committees. And yeah, I think I've got a commitment to a minimum of 2-year term, be an active CoC member. Be an active member of the CoC for at least 2 years. This is what the executive committee is proposing, just because it takes so much. I think, speaking for myself, it takes time to really understand the complexity of the CoC and the work that you do. And I think being a member for just 1 year is not enough to really understand everything. And it's easier to start to put all those puzzle pieces together when you're engaged in a committee work as well, and you're offering suggestions to the board and making reports and things like that. So that committee is to be formed. And we have a timeline for that formation for the November, December election time period. Did I miss anything? What do you think?
No, that sounds right. We'll have applications that can go out. So we'll send out, especially the folks who are involved in any committees, then ideally they would have.
Ideally, yeah. And I just reach out to Sherry or myself, but really Sherry, she would coordinate all that.
You can also, yeah, and if you have if you need to, if the easiest email address is info@hlapinellas.org. So if you don't know who to reach out to, it will make its way to me, or whoever needs to have it. Not always me.
But the advocacy committee is a great one. But from my personal experience, when I first started on the board as an appointed member 5 or 6 years ago, I got involved in attending. I don't know that I was an official member, but you can attend the funders and providers meetings, because those are the people who are really there in the trenches, especially those providers. And then the funders, you know, my entity was part of a funder, but really to understand where those challenges are with funding, what it can be used for, how you make those two things fit. And now our funders and providers are having more joint meetings, which are really productive and enlightening. I was there for one of the first ones when I was serving, and it was just, it's amazing how in sync, there wasn't a lot of disagreement about what our needs are and what our funding looks like, what our funding hopefully could be. So anyway, I just pitch for those two. Councils are important to learn if you really want to learn. Any questions at all about those? Okay, HUD NOFO funding is what was next you're interested in?
Yes, okay, yeah, Chris,
Okay.
he's like, what about the NOFO?
Yeah.
So we're expecting the FY 26 NOFO to be released sometime over the summer, most likely. According to what's written down somewhere, January 1st is when we're expecting it. And we are anticipating it. Sorry, June. Hello.
So no vote, no vote.
Yeah. I'm still stuck in November. That's where it's at. June 1st is when we expect it. I have talked to HUD TA though, when we spoke up with her, she said July. I'm still, we're aiming for by June 1st to see that drop. We are expecting it to look a lot like maybe the second NOFO that came out, and the one that came out in December, the one that was for public review. And so maintaining those priorities that HUD had established before, that's really looking to address street homelessness and transitional housing, shorter term interventions that leading to self-sufficiency is what HUD's looking at, and behavioral health treatment or treatment services. So that's, but the FY 25 NOFO business is still in litigation. There are appeals going on right now. It's still ongoing. One piece of ray of sunshine-ish, like a little bit here, is that we did receive notice that awards for quarter one, the first quarter, the first 3 months of the year, that any renewal project that had expired within that time was awarded, received a public award to be refunded, renewed for another year. We don't believe any contracts. I haven't heard of any CoC that's, okay, no contracts have gone through yet. So, but the announcement was made by HUD. And so that's, are there any questions around any of that right now? I'm opening a can of worms when I say that. Okay. We have hurricane season planning. I wanted to just real quick plug. I know we have our Pinellas County partners here. I'm not putting you on the spot on this one at all. But HLA and Pinellas County Human Services and the Emergency Operations Center, we partner together around to prepare for any natural disasters, especially hurricanes that may come up. And so we have a few sessions planned where HLA we're a host, and 3 sessions where the EOC, Emergency Operations Center, took me a while to know what that was, and Pinellas County will be leading, facilitating those, but also HLA as well at the very end. We facilitate too. We will do a brief overview of what we do, how we work with our providers to make sure that everyone, service providers, people who need to have communication sent to them when there's something going on, that people aren't left out in the street without knowing where to go to be safe. And so I know that I was here, I had just started with the HLA when Hurricane Helene, when a NOFO dropped, and then Hurricane and Milton came in back to back. And it was really, it was pretty amazing to see all of the providers get together, the county, HLA, all the staff, daily huddles to keep track of what's going on before and after the disaster, leading up to and following. And then after that, even trying to stay together around what FEMA was doing and who may be falling through the cracks or leaving a program and ending up in the streets again, or in a situation that's not so great. So very strong partnership there. And I just want to remind everybody, June 1st is hurricane season. We had a very wild weather, winter, for cold night shelters were activated 11 times, which is a record for us. And they were all done pretty much like halfway through the season. They started before the season. We almost had to activate more than that, even beyond the season. So, but didn't. And so with weather changes, we are working together. And I just wanted to throw that out there that if you, especially if you're a provider, anyone, if you just make sure you sign up for any alerts. Make sure you will get information from the HLA, you will get information from the county, from all the different places. You can sign up for an alert, do it. And we'll be sending out more information as it's made available. And then World Homeless Day is coming up. So October 10th.
Yes. So Dominique, did you send me that information about that when you were at a conference? Yeah. So I learned about World Homeless Day, from Dominique, who sent me some information when she was at a conference. And so this is on October 10th every year. And different communities do different things to recognize, certainly not celebrate or honor, but to recognize our homeless population and, acknowledge, I think, our efforts. And so I just wanted to put that out there. You can Google up World Homeless Day and see different activities and events that different communities throughout the world have engaged in to draw attention to this challenging situation. And I'd like to do something this year in our community. So it's something that we'll be talking about at the board. I would, bring it to our advocacy committee and see if they have any ideas. But you as general membership, if you're aware of this designated day and what other communities have done, or you'd like to be involved, please reach out to us. Dominique, did you have any light bulb moments at the conference about that, or?
Oh, that honestly, that wasn't even discussed at the conference. I was just, on different
Okay.
But it is something that we have not participated, as far as I know, in recent years. Something unique to my role is that I coordinate like health fairs and information fairs throughout the year related to the Pinellas County Health Plan and healthcare for the homeless. So we coordinate 4 of those a year. And so my thought was to kind of amplify that as a multi-site service fair across the county, getting various nonprofits involved in that mission as kind of that weekend. I was Googling this and I didn't get it in time. There's also a faith-based component to it where they're encouraging churches, because I believe it's on a Saturday this year, but they're encouraging churches to also get involved as part of that mission. I should say faith communities, but on that Sunday, the 11th. So if anyone's interested, I'm hoping, that, like you said, you brought it forward and that was something we can grow on and maybe support.
I just got thinking, it just like clicked because we just came out of hurricane. It falls right in smack in the middle of hurricane season. I wonder if, like, for this first year, maybe we could put together, a video compilation and show it somewhere, or put it out with the news or something as a, in case we have to cancel something that might be planned. We could kind of do 2 things at once through the next few with our lived experience advisory committee and stuff. I know they've done some work on composing a poem, and we could have a backup in case. But I think that's got to be a consideration of our vulnerability at that time of year. But yeah, we could, your events, we could build on, right? Your outreach. Do you have them? Is it scheduled around October-ish?
I don't have one currently scheduled for them, but I mean, like, I can't remember the name of it, but across St. Williams Park, every Friday night, they're doing an event over there, right? And just like expanding on ones that are already existing in the community naturally. Dream Center does Adopt the Block every Saturday. So is that something that they could incorporate at the neighborhood park? Tarpon Shepherd Center, and making it a multi-site service intended for the unhoused to come and really glean something from.
Great. Okay.
Nothing on the chat?
Okay.
We also have, there's another announcement.
Well, so the work that we do and a lot of the stuff that we see. So April is Fair Housing Month, which is a really big deal. As we know, 58 years ago is not a long time. In 1968, Fair Housing Act was passed. And when we look at, our neighborhoods and what's going on just here in St. Pete alone, we see a lot of that, right? We see the work that's been done, but there's so much more to go, right? So National Fair Housing Month is April. That's a big deal.
It's also child abuse prevention.
Also
Yes.
Child Abuse Prevention Month.
Those things kind of go hand in hand.
Right.
It's interesting, isn't it?
Okay, we will move on, Dominique, then to agenda item 4, our point in time count presentation and recognitions.
Absolutely. So hi, everyone. Dominique Brandel again, Pinellas County Human Services. So this actually happened. So I chair the point in time committee, which is one of the CoC committees I was mentioned earlier. Our next meeting, we actually have a seasonal meeting. So our next one is going to start off in August. Point in time is an annual, what's actually biannual, required by HUD, but we do it annually here in Pinellas County. I've had, at one of my first jobs back in the community, they told me to go to this meeting, and it was the point in time committee. So I've been part of this committee for a while and the chair for the past few years. Last year, they started coming up with the idea for awards. And so there's a few award recipients in this room from years prior and virtually. I'm glad you all were able to join us. And I was just asked to come and present the awards for this year. So not everyone is with us, but we do have some in person and online. And so I will put everybody on the spot and be awkward.
Yeah, we're not getting up for this.
So our first award, which was created last year, is for the Pinellas Point in Time Volunteer Champion. This is 2 years running. The city of St. Pete received this award for recruiting and activating over 40 volunteers. The county and the city of Clearwater and the VA, we tried to compete, but the city of St. Pete was the clear winner on allowing their partners to volunteer. Come on, Bill. We'll send them over. We're sending them. Oh, no.
Yeah.
Oh,
All right.
is this gonna end up online?
As Chris says, everybody the right?
To the left?
Yeah.
Yeah.
No.
Yeah,
No problem, I got it.
The next one was her.
Okay, I was just gonna ignore that one.
No.
All right, our next one is the point in time champion. And so this was given last year actually to Kevin as a board member that has just an incredible active involvement in the point in time process. And so this year it was Chair Beckman was selected. She activated, I want to say 5:15, 5 o'clock in the morning. We had a cold night shelter the night before. And so she deployed to Clearwater.
Yes, thank you. It was a pleasure. Dominique.
All right. Next, I don't believe he's online, but he is actually a Pinellas County employee. He created the app. So the landing page as well as the dashboard. All that data then gets sent over to Dr. Freeman Gerhardt, who does all the analysis and the report, which I don't have none of that's out yet. I don't have any secret insight. I have no insider information. But his name is Oladapo Satire Gun. Dapo, like I said, has that brain to create the app, the platform, and all of the analysis that bringing their person from. And also was a huge support that was recommended by the HLA because was a huge support to TV, who was new in her role, and just it was very clear that she very much appreciated him and his work to help. So next is our point in time survey champion. She was not able to join us online today, but Miss Kathy Ham, who completed well over 30 surveys herself. So that is her second year running as well. So City and Kathy are in contention. And then our training award actually goes to TV Lee, who was on vacation this week, probably somewhere wonderful. She always vacations well. But it was to TV Lee, Tanvan. She jumped into this role head first this year and was identified as the point in time training champion, as she was literally in every single training video, the recording and otherwise. So with that, thank you so much.
Good job.
To present, but just want to say on behalf of someone who sits on the PIC committee, thank you so much, Dominique, for all that you do. And then do you want to present it to her?
Absolutely.
Yeah.
She's amazing.
Dominique, this, you want to?
Very much.
Yeah.
A certificate of appreciation, 2026 Pinellas Point in Time VIP champion, Miss Dominique.
I was
For being-
Thank you. So Dominique says she has shared. Hold on. Dominique has shared our point in time. I don't even know how many years we are now. Dominique, 3 years now. And she will be probably voted next year to be the point in time chair. But I will say, because we're already on that, I will say for Dominique, she when we had the storms back to back, she just stepped up and made sure that we all stay on task. Even last year, like we were in the midst of a really rough time trying to figure some things out. And Dominique was right there to say, hey, this is what we need. Even if our teams couldn't come through, the smaller committees, she was there to kind of pull us back together. So we truly appreciate you, Dominique.
Thank you very much. Everything. Incentives, locations, testing the app, the survey questions.
You know, because you were so involved.
Herding cats. That are like missing two paws.
But this year we deployed around 231 volunteers. That was honestly the lowest number we've had in a few years. So we're going to try and amplify that in the coming years. Shortage of volunteers, especially in North County, probably because we were able to get so many from South County municipalities and organizations. So we're going to try and encourage that through the next year. Fundraising is also something that is going to be needed for the upcoming year for incentives. And so we have hopefully some work being done on that. Right now, the numbers are looking like they will be decreasing based off of kind of preliminary numbers, the total numbers of those collected. They still need to be deduplicated and cleaned up basically to make sure the data, what it looks like. And like I said, I haven't had any sort of inside scoop on that. But that report is due and scheduled for July still.
Yes, but there's the HMIS does a lot of the work to report to the state and to the feds. So that reporting is underway and should be completed by the end of April. We're hoping everything will be ready.
And then, like I said, we meet from August to February. The event is in late January. So we would love anyone that's interested. I'm happy to connect you with the invite. And it is located on the HLA and COC's website. So thank you.
I have a question. Was that the first pit count that we had that abutted a cold night shelter that night previous?
As far as people know, yes.
Okay.
Yes, far back as people can remember. And there's people have been doing it for a while.
Yeah, because we've never gone to a cold night shelter to do a count.
I've been doing it since 2010. That's the first one I covered.
Because it was a little challenging. At first, I was thinking, my 100+ people at First United Methodist would be good to interview them because they're there. But when we have people, our volunteers who have to get to work, have people exiting the building and it's still below 40 in the morning or something, nobody's standing around waiting to be interviewed on a phone. And so it wasn't as easy as, you might have thought it was going to be. Yeah, hoped it could have been. It was a very cold morning, and then the sun came out in the afternoon.
Anyone?
Okay. All right, so we have member announcements and opportunities. Members are invited to briefly share any relevant opportunities, resources, or updates. Why don't we start with here in the room first? Anyone have any updates they'd like to share? And then we'll go online. Okay. Anyone online have updates or announcements? Resources or opportunities?
Arrow from the city of Largo indicated that there's the 22nd annual Tampa Bay Fair Housing Symposium, which is put on by the Tampa Bay Fair Housing Consortium. And she put a link to that in the chat.
Thank you, Arrow. Is there anyone else? Nothing else?
Can I go back to the hurricane training real quick?
Sure.
I mean,
Hurricane training? Yep.
So it was mentioned, the 3-part training for hurricane series. I think it was sent out to the CoC membership as well. And so I just wanted to talk about that just a little bit more. So actually Monday is the first session and probably the most appropriate for members. It is the 101 basics, like groundwork. So if you're new to the community, if you're new to an agency, you have staff, that's the one to really encourage people to participate in. It will go over like the core basics and how we serve those who are unhoused in that process as well. 4 of our 6 homeless emergency shelters evacuate during storms. And so we coordinate that and we'll go into depth about that, but also it's just good basic information for members in the community. Mentioned like Ready Pinellas and some of the other opportunities there. The second training series is going to be one on resources and funding. So we have Sunrise St. Pete, which is the CDBG-DR funds that came through, as well as Pinellas Recovers, Bay Area Legal, and we're hoping to get Career Source as well to talk about their programs related to disaster and disaster funding. So if you're a small nonprofit, you sit on a board, you participate, you work, you personally weren't impacted, these funding streams may be available to you. They're going to have opportunity to speak. And then the third one will be more traditional to our hurricane season kickoff, where we just talk about what's changed from years past and how we're going to continue to communicate it out. So just want to take that one more time. Happy to share information with you. Thank you.
Then we have our updated homeless resource guides, these little yellow books. I'm going to put the link in the chat. It is the updated version, and those are available now, and the link is in the chat.
And I'll make an announcement when we're looking at our vacancy list that the Board of County Commissioners has reappointed Commissioner Vince Nowicki to the HLA board. They put on future meetings. Okay.
Yes, and before getting into input, our next meeting for membership is August 11th. And our info session, though, definitely want this down. Info session will be June 9th from 5:30 to 7. We have 4 info sessions a year. And usually we have a lot of guest speakers come in. Dr. Chris Warren did one. Our last one was around aging out youth aging out of foster care who are experiencing homelessness and other youth services as well. And this are available to the people. Our next one, though, will be an introduction to the Pinellas CoC, like all about the CoC, what it is, what we do, what questions you have, why would someone want to join? That's going to be on June 9th from 5:30 to 7, completely virtual.
And recorded.
And recorded, yes. So you'll be able to watch it at your leisure and over again, too. We know how you binge watchers are. And so for input on future meetings, and this is open to everyone, of course, any ideas that you would like to see in future general membership meetings, whether it be format, presentations, we're just open.
Topics. Yeah.
This is Jason Mathis calling in. I wondered if it'd be possible to have like a success story or two shared. This is really hard work that everybody's doing, and there is great success out there. And I think it'd be helpful for people to say, yeah, this is this is a family whose life was changed for the better, or this is somebody who, maybe was resistant to shelter for a long time and then made a change in the way that they felt. And anyway, I'm coming to this from the business perspective, and I'm so grateful for the work that all these folks are doing. All of you are doing. It's really meaningful. But I think a kind of a highlight of some positive stories that people whose lives have been changed could be super, super helpful. So anyway, that might be a suggestion for a future meeting.
Thank you. Anything else? Do you have any more chat?
Nothing additional in the chat.
Then public comments, and if in these public comments, if you wish to share a success story, by all means, please do. That'd be great to head us out.
I mean, I'm sure I can think of one pretty quick.
Mhm.
One should I share?
Which one?
You want to think down? I have one I can share while you're thinking. So we had a member of the Clearwater community, Jennifer Haithcock, who came to the Clearwater community and was homeless and was struggling with some mental health issues. She reached out and she was living in her car behind a Wawa and was kind of resourceful that way, was driving for Uber, all that kind of thing. But she worked through the system. Every now and then she would, and I share this because she shared this information with our lead committee, and she's also shared it publicly. She would speak before the city council and share her experiences. But through working through her program, she was able to get supported housing in Largo, and she was very healthy. She was a member of our lived experience advisory committee, very engaged, real advocate throughout the community. She would often pick up books and distribute them, the little yellow books, or encourage people to attend meetings. But she recently moved up closer to family in North Carolina and is doing very well and is continuing to receive her, support services that she needs to maintain a good life. So she's doing good.
I'd like to share one of the Boley stories. This was a person that actually came in through coordinated entry, was homeless for 3-4 years, involved in mental health issues, involved in substance use, came in through Safe Haven, moved on into permanent supportive housing, was in permanent supportive housing about 5 or 6 years. Then moved out, you could effectively say graduated, moved on from there into his own place with a girlfriend, and then wanted to give back. So he joined our board of directors as a lived experience board member, served on our board for about 4.5 years, recently took a leave of absence because he started his own rehabilitation program, went back to school, got his master's degree, and is now doing the work that we're doing, and doesn't have the time to serve on my board. So couldn't think of a better story than that.
Good.
That's fine. Yeah, that's great.
And has been clean and sober for, I think, 12 years now.
Good for you.
I think probably the most recent thing would be related to the butterfly project, which Helen the city was involved in this situation recently. We had an individual that we've been working with, and he had approached a woman and a child that was getting into the vehicle to leave to go to school or something that morning. And the neighbors had ended up contacting us, and we in turn immediately contacted the police and worked with the PATH unit, and were able to get the police department to issue a BOLO because this was an individual that was known to us. We do know for sure that he has schizophrenia, that he is in active psychosis. We had been attempting to locate him, to Baker Act him. We were not able to find him, but through the collaboration of the city, the PATH team, and the Firefly Project, we did eventually locate him. He was in fact Baker acted, and he is currently being assessed for the state hospital. As an individual who has been to the Florida State Hospital in the past, and even while at the Florida State Hospital under psychiatric treatment, he still has psychosis, not as intense, but his psychosis, unmedicated, he bangs his head against the wall, the ground, he hits himself. It's very, very intense. It's a younger guy. So the success story would be that we've gotten him to the appropriate place to be assessed for the best treatment options possible.
A little bit lighter. But it's heavy on my heart because it's representative of a long saga. One of our youth that had aged out of foster care, a young Haitian guy, when he was put out, and unfortunately he was put out without his birth certificate or a passport. And the same family had him for 8 years and they never made him a naturalized citizen. So when he got out and he was attempting to engage in our services, we had him a job. It was easy money. I was like, this is great. This is easy. Unfortunately, of course, it was through the county. So it pinged other agencies and ICE came looking for him. Oh. And we very successfully navigated their ability to find him until we were able to get all of his paperwork done. And we were able to get it all done. And thanks to our new amazing fire chief, Mr. Keith Watts, he is now on his way to becoming a St. Petersburg firefighter.
Oh, wow. Good.
Your stories are getting so many hearts and
Yeah.
claps.
Right.
Everyone.
You haven't lived until you've run in church shoes when you see ice coming down.
Well, we do have challenges, but we've got such great people on the call and here and people who are out working right now. So it's amazing, the amount of coordination and talent and dedication and determination. It really is impactful. It never seems to be enough, but what you do is impactful and makes a difference. And I appreciate it. And I know, speaking for the board, we all appreciate it. And yeah, I mean, it's emotional work, right? It's tough.
If you ain't crying, you ain't
I
trying.
know it. I know. So, yeah.
I could share something. We're like brand new at this, but I'm the director of a small nonprofit that provides housing and support for single moms and their kids. And we're a small program. We currently have 11 families in housing. But we just had our first graduation last night of 2 women who have been in our program for 3 years. And one of them she was abandoned by her mom when she was 10, and then was placed in foster care, was trafficked in Tampa by her foster family, and had never lived in her own home until she came into our program at 32 years of age. After coming into our program, she was reunified with her youngest daughter, who had been in foster care since birth. She left our program with a livable wage, having been accepted into Habitat. She'll be getting her own home. And she, that daughter, she's permanently reunified with also the 2 children that were conceived when she was trafficked as a teen, who were then placed with a guardian who eventually put them up for adoption, found her last month. And so she's been reunified with all of them.
This is a Netflix show. I want to watch all season of that.
What's the name of your? It's called Selah Place.
Say it again, please.
Selah, Nelkh Place. Yeah.
Thank you for sharing that.
Yeah.
Unbelievable. Yeah. Well, thank you. Well, thank you everyone who's attended tonight. We've got a great number of people online, so thank you for being here. I hope that you were able to hear adequately and the electronics and technology cooperated. But I appreciate you coming to our general membership meeting. And everyone that's here, thank you for being here in person. And with that, we'll adjourn the meeting at 6:49. Thank you very much.
Yes, this is